Hi, my name is Jose Pulido. I'm professor at the Department of Ophthalmology and Molecular Medicine at Mayo Clinic in Rochester, Minnesota. And we'll be discussing an article entitled Clinical and Histologic Findings in Patients with Uveal Melanomas After Taking Tumor Necrosis Factor-α Inhibitors. My initial concern about this was the fact that I started noticing that certain patients on TNF-alpha inhibitors, namely two from here and one from Yale, developed melanomas very quickly, and two of them were from pre-existing choroidal melanocytic lesions, and within the space of a year or so they became full-blown uveal melanomas. The other was a patient that had scleritis and was placed on a TNF-alpha inhibitor, and in the very far periphery, just because we were doing ultrasounds, we were able to ultimately find that he also developed a ciliocoroidal melanoma. I went back and looked at the literature, and it's very nebulous as to whether the TNF-alpha inhibitors increase the risk of melanomas or not. You can find in the literature that TNF-alpha has been used, so not the inhibitor, but TNF-alpha itself has been used for the treatment of melanomas. And since multiple studies now show that melanomas can be affected by the immune system, I am very concerned about the possibility that TNF-alpha inhibitors might predispose patients to develop melanomas. And so, invoking the precautionary principle, I think that it's very reasonable in these patients, until further data is known, that before treatment of patients with a TNF-alpha inhibitor, they should be evaluated to see if they have choroidal nevi. And about 3% of the population do have choroidal nevi, so it is not a small subgroup of patients. In light of the fact that TNF-alpha inhibitors are becoming so commonplace in its use, and that 3% of the population have choroidal nevi, I think it behooves everyone concerned to obtain a baseline ocular examination. And for those who have higher risk factors for their choroidal nevi, and there's certain anatomic risk factors that ocular oncologists are very well aware of, those patients should be monitored more closely than they would have otherwise. Thank you.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.com. This video content is copyrighted by Mayo Foundation for Medical Education and Research.